All right, so in this video, what I'm going to go over is how to roll your hip flexor. So first off, what I recommend using is this ball. So this is called the Orb. I have a link to it in my product page, but I feel like this ball really is the perfect size to get this done. I use this, to be honest, for what I'm about to show you, my hip flexor. I use it for anything that I'm rolling in my lower body. It could be my quad, my hamstring, my adductors, it could be my calf. I don't really use it for my foot, but otherwise this ball really is great. It comes in pink or blue, I believe, as well, so if you like that. And I'm not really sure on the price recently, sorry. But you can use this. Other option is a lacrosse ball. Tennis balls are usually too squishy for this. Lacrosse balls or a yoga ball or massage ball works really well as well, but not as well. For this, I find that my soft tissue just gets in the way. I have too much soft tissue and I just feel like it doesn't really get in. It just kind of sits on my stomach. So if you are going to use this, I'd take a textbook and put textbook down and put the ball on top of that, or a yoga block works as well. So I've had some people have results with that, but this is the best. So what you're going to do is, let me explain what your hip flexor is first. All right, so your hip flexor, balls rolling everywhere. Your hip flexor is the muscle right through here. So it's kind of in your stomach and then it rolls down to your leg a little bit. Sorry, I've got my lacrosse ball rolling everywhere. Okay, so that's your hip flexor. It's responsible for bending your at your hip, bending up, flexing your hip. The hip flexor, the muscles at the top of it actually attach to your spine. So it's really, really deep down there. And the reason this muscle is really important to do for if you're having some back discomfort is if this muscle in the front is tight, it's going to pull me into this position. I'm exaggerating it a little, but it's going to pull you into this position, which means to stand up straight, I have to basically arch up my back, which is going to cause increased strain on the structures in my back. So what happens is the back muscles and the front muscles, the hip flexor, they just kind of constantly fight each other, and then it just feels like they're tight forever and ever. So in order to really loosen it up, rolling is really great. So rolling is going to kind of get those tissues to relax a little bit and release their tension. So then you can go strengthen them and educate them on what you want to do. But that's the purpose of why you're using this ball. So I'm going to kind of point out where you're going to put this ball, because once I demonstrate it laying down, it's really kind of difficult to see where the ball actually is. I do recommend doing the stretch on both sides. I'm only going to demo the one side, and that's because the camera positioning, you can't really see me on the other side. So what you're going to do is, if you were to stand, and you can kind of, so I actually want, before you do this, I want you to stand and just kind of tune into your body in the front and your back and see how it feels. I'm going to have you do that at the end as well. But what I want you to do is find the bone that kind of sticks out in the front here, your skinny bone. And with that skinny bone, you're going to basically go directly to the inside of it where the bone isn't anymore. So it just kind of feels a little bit hard but more soft tissue-y. The ball is going to go there, up kind of into your stomach, and down kind of into the leg. So we're trying to get this whole area with the ball. So one side, the other side. I'm not trying to go into my ribs, I'm staying below. And that's what you're trying to get. So with this exercise, with this type of rolling, what you're actually going to do is use your body's sympathetic response. So if you've heard of fight or flights, your body needs to relax sometimes. With this, what we're going to do is do some relaxing breathing techniques to actually get the ball on the tissue and then the tissue to relax. All right, so to do this, I already showed you where we're going, so you can find any one of those spots with the ball. You can even play around with the top, the middle, and the down. I'm actually going to have you go to all three of those different spots, but one might be a little bit more tender and uncomfortable for you than another. So what we're going to do, if I don't rip my microphone out, is take the ball, you're going to lay down, take the ball, find that bone and go directly to the inside. And then you're gonna put some pressure on it by just laying on it, okay? And then I want you to take some deep breaths. It's gonna be uncomfortable, and that's okay. Just take some deep breaths and kind of relax into this. Deep breath, deep breath, and deep breath. And at some point, you can kind of see how I'm getting closer and closer to the floor. At some point, I'm actually able to kind of lay down and take some breaths. And then I'm gonna have you, once you feel a little bit comfortable with that, take about 5 breaths. I'm gonna have you bring it up a little bit, and you're gonna start again. Now, if it just feels like it's in your stomach, go a little bit more to the side. If you get any sharp pains, I want you to go ahead and back off, hold yourself up a little bit more with your arms. But it should just start to relax into your breaths. Good. And then you're going to go do the lower part, which is almost like at your hip crease, kind of, but a little bit more inside. And take 5 deep breaths. Perfect. All right. So then I want you to stand up, see how you feel. You should feel a little bit of a difference between the side that you did and the side that you didn't do. And then I want you to go ahead and equal yourself out on the other side. So 5 deep breaths essentially in 3 different places. So for this, I would recommend doing this 1 to 2 times a day. This is great to do if you have a sitting job. I would do this, to be honest, I would do it as often as I could. Great to do when you get home. Great to do at lunch. You could bring this to work. I used to work somewhere where they actually had foam rollers and balls out for people to go do things, and people did it throughout their day. So really find what works for you. I know there may not be a spot to kind of lay on the floor, but just do what you can. So this really relaxes those tissues that we're using to sit all the time. So right now, I'm just telling that muscle to be tight. Whereas when I go and lay on this and do it the other way, it really should feel a little bit more comfortable. Okay, so that is foam rolling for your hip flexor.